Hello, everyone, and welcome to this episode of the series Exploring Careers in Global Security. This episode is titled The Pandemic and the Need for Collaboration. My name is Sophie Bardetti, and I'm a member of Middlebury's class of 2022. It is my pleasure to welcome this episode's guest speaker, Pam Berenbaum. Pam is the director of the Global Health Program and professor of the practice of global health at Middlebury College. Pam has been with Middlebury since 2010, and prior to her time working in academia, she gained many years of experience in infectious disease epidemiology, syndromic surveillance, all hands emergency preparedness, bioterrorism, statistical programming and analysis, program evaluation, and economic evaluation, just to name a few of her skills. Welcome, and thank you for joining us, Pam.
Thank you, Sophie. It's always great to chat with you. It's nice to see you on the screen. I wish we were doing this in person, but someday.
Good enough. Hello.
Hello.
Pam, this series explores a number of different global security challenges facing the United States and the world. This episode in particular focuses on the current pandemic, but also future global health challenges. How would you describe this current moment in global health history? What is being done to address the pandemic challenges globally? More importantly, what needs to be done?
I think we are at a unique moment historically. This pandemic is playing out against a background of really extreme inequality, like more inequality than we've ever seen in the world. In terms of health outcomes, the social and structural determinants of health, and with technology. I mean, when you think about, a third of the world, it's like 2.2 billion people, do not have access to clean water, on a daily basis for basic hygiene and drinking. And yet you can go to a water bar, that's a thing, where you can get a bottle of water that costs $100,000 or a glass of water that costs $25, like one glass, And so these disparities are really shocking. And also in terms of technology, so the same folks that don't have clean drinking water have Coca-Cola and they have cell phones. So it's just, it's a pretty wild time in human history. And then when you overlay a pandemic on top of that, a pandemic that requires both basic hygiene to keep people safe and technology to do genetic sequencing, to develop vaccines, like it's just a real challenge. And we're just getting to the point in this pandemic where developing countries are starting to be hit hard. The wealthy countries of the world have had a hard time managing this pandemic. And truthfully, on a global scale, I think we're really still kind of at the beginning of the pandemic, which I hate saying and nobody wants to hear, but I'm afraid that is true. So, and I think everyone's, like those of us who live in wealthy countries who are surrounded by technology all the time, we've got our computer and our cell phone and we're so kind of like hyper stimulated with information and life moves so quickly. Early on in the pandemic, people kept saying, and you've probably heard people say this, it'll be gone by summer, because we just are so used to living in the fast lane. And the world has not had to deal with a slow motion catastrophe, like this one. It's moving faster than climate change, but it's kind of, this is a marathon and not a sprint. Mm-hmm. And we're used to sprinting in our current, state of affairs in the world with technology. In terms of what's being done, there are a couple huge international initiatives that really are fantastic. There are actually numerous genome databases around the world. And this has increased our understanding profoundly of this virus and how it's evolving. And China, uploaded the genome of SARS-CoV-2, I think it was January 10th in 2020. So we've had a good year of studying this, and there's really an unprecedented level of scientific information sharing to help us understand microbial threats. So that's all been great. And then there's the COVAX global initiative, which is sort of a complicated scheme, but it involves countries recognizing that, we're all in this together. When there's a pandemic, countries really can't isolate themselves easily. And it's incredible that there's a vaccine now. That's a whole separate, the speed with which this vaccine was produced was really mind-boggling. And a lot of people realized early on that if we do things our usual way, wealthy countries are going to get this vaccine and poor countries are not. And so the COVAX initiative is sort of a consortium of countries and foundations, a lot of different players that are pre-purchasing vaccines. And there's sort of like some price differentials so that poor countries can also have vaccine and be able to afford it with some subsidization from wealthier countries. And the initiative was not as successful as they were initially hoping. There wasn't quite as much buy-in from the wealthy countries, but it is nonetheless really sets a precedent for global cooperation and does provide some hope that everybody in the world will be able to get the vaccine. Because we really need to understand, as long as, when you're talking about a pandemic, everybody has to be protected. With global movement, you can be anywhere in the world in less than 24 hours. Right. So you can't, diseases they know no borders. And so the COVAX initiative is really acknowledging that and trying to correct some of those disparities that are just going to prolong the pandemic. Anytime there's an emergency, it's a little viewfinder, where you can see what you should have done. And what's been missing in this pandemic is preparedness and prevention, and it's not in our nature to be really good at preparedness, and there are many reasons why public health preparedness is not where it should be. It's really hard to, for instance, stockpile PPE when there are so many pressing needs right now. And it's hard for the world to do sort of preparedness for an emergency that may or may not happen or might not happen in the next 20 years when people are, children are dying right now. But then the emergency hits and then we're like, well, we have all these preparedness playbooks on the shelf that just don't get followed. And someday we really need to realize that, as they say, an emergency is a bad time to be exchanging business cards, like you really need to do that work in advance. And what we really need to do, not only for future emergencies, but for this one right now, is get a better handle on veterinary health and environmental impacts. COVID-19, like most pandemic or emerging infectious disease, viruses, it is a zoonosis. This comes from humans and animals interacting through an altered environment. And we really need to adopt a One Health approach. And there was a scholar, Olga Jonas, came and gave a talk through the Roatan series of talks this past fall. She was a One Health champion at the World Bank for many years. And, people are altering the environment in ways, new ways, just in the course of human history. Our changes that we're making to the environment, anthropogenic effects, the way that we're interacting with animals, exploiting natural resources, it's truly a historic moment. And that is what is giving rise to zoonoses. And we really need to just step up our collaboration between human health and environmental health and veterinary health. And we can start that right now. And we're trying to understand, where did this pandemic come from? And that's where the answer lies. So we really need to step that up to prevent the next one.
It reminds me of something I came across when I was working on the Locust project yesterday, that COVID-19 has been described as an entirely predictable result of humanity's destruction of nature. And that another piece of information from this article was that 75% of infectious diseases that have been discovered in the last 30 years are zoonotic diseases.
Yes, that's exactly right. And if you go back and look at the literature over the last 40 years, you will find hundreds of articles describing exactly this, talking about zoonoses, why they're increasing, the fact that a big pandemic was coming. The people who research this stuff have been saying for decades that we are overdue for a massive zoonotic pandemic. And here we are, And so at some point, we need to start using our knowledge, proactively. But it's a hard thing for people to do. I understand why governments have a difficult time allocating resources towards a threat that is only hypothetical at the time that you're writing those budget lines. I understand why that is, but at some point, we need to just internalize the fact that we need to do this. It's not easy, but that's where we need to go.
Yeah, I hear you, Pam. I guess if you'd like, we could address some of the limitations and challenges that address global institutions and actors as they work to collaborate, and talk a bit about some of the barriers that prevent sustainable solutions, and mitigation, preparedness, whatnot.
Yeah. And, this is where my public health colors kind of show through. But to me, the root of all of it is really inequality, income inequality, wealth inequality, social marginalization, inequality literally makes people sick. And there's been interesting research that shows that even in wealthy countries, the more unequal countries have a sicker population. So even the wealthiest people are sicker than they are in a country with similar wealth but less inequality. And inequality really, it creates a lot of problems for the economy. Like if you look at, for instance, our healthcare system, people that do not have health insurance, there's an inequality right there. They go to the emergency room for a lot of primary care. That creates cost, that creates a burden on the healthcare system. We're paying for it, we're paying for it after the fact instead of upfront. And governments are pitted against each other instead of cooperating with each other because they're trying to put out so many fires, And in terms of global cooperation, we have our economic interests and our strategic interests that dictate which countries we're helping and which ones we're not. And I definitely don't, first of all, I hope it's clear at this point that I do not have the answers and the solutions on how to do this, but I have some insight into how we got here.
We're not going to single-handedly solve a global pandemic in a 30-minute interview.
Not this time, maybe okay. For the next one. But
I'll put you down for a rain check.
Yes, thank you. So, all that to say that while there's this inequality, everything is a zero-sum game, where wealthier countries are trying to protect their privilege and their wealth, and, poor countries are fighting for a piece of that and are resentful, that we want to put a military base there, but, everyone's hungry and, resources are always scarce, but when they're not allocated equitably, there's always going to be resentment. There's always going to be, a fight for a piece of the pie. And our international bodies, like the World Health Organization, the WHO, which presumably everyone thinks, well, they're the ones who are in charge of global health, they have no authority. They are really a scientific body that advises, that they do provide some funds, for things on the ground, but they are mostly providing technical expertise and policy guidance. They have no regulatory authority, and they cannot interfere in the affairs of any sovereign nation unless that nation invites them in. So a lot of people, have this misunderstanding that the World Health Organization is somehow in charge of it all, when in fact they are very, very disempowered, and their budget, most of the money that they get from countries is earmarked for specific purposes. So there's no captain of this ship globally. And so, we have the WHO, we have the United Nations, but they are not there for global takeover, and global dominion. And it's very tricky to figure out how to get countries to work together in ways that do not undermine sovereignty. And I think my answer has gone way far afield of your actual question. So
marvelous. I really
toss it back to you for where you want this to go.
I really like that line. There's no captain leading this global ship. And I just
throw it along.
Certainly. It leads me to ask, what would a scenario look like that there is a global captain? And also, I'm curious as to who are the captains, at least at smaller levels, whether it's local or regional, state to state.
Well, if we go back to the sort of the question of preparedness, that's where you need a captain. So, for instance, in COVID-19, back in the spring of 2020, there was this mad scramble for PPE, for personal protective equipment. It was masks for healthcare workers, basic stuff. And states were pitted against each other, trying to break into some supply chains and get supplies. And then the federal government was actually taking stuff away from the states, and back on the preventive side, that's where you need a national government can create those stockpiles or create a distribution system, without having things disintegrate at the local level. In terms of actual response, then the local players are much more important. But I also want to say, that when we talk about captains, it implies there's some, sort of really powerful authority figure. But I also want to make it clear that people on the ground are a huge part of the response and the intelligence about the pandemic, and even potentially as sentinels. So when I used to work in syndromic surveillance and emergency preparedness, there was always this phrase about the astute clinician. So you can have surveillance systems in place, but you still need people on the ground saying, something here is not right. And there's a couple instances, in the early days of West Nile virus, there was, as an example, there was it must have been a crypto outbreak associated with a recreational water facility in the Midwest, a big water park. And the syndromic surveillance systems at the time were monitoring emergency room visits, but crypto is a disease where you kind of just are dealing with it at home. And one pharmacist called up the health department and said, I don't know what's going on, but Imodium AD is flying off the shelves. Something's happening. You guys, I'm just telling you, something fucking is going on. And it turns out it was this one pharmacist that tipped off the health department that there was this massive outbreak. And if we think about zoonoses, livestock farmers going forward can be a potentially great source of intelligence that there's some new strain of something that's making animals sick, that maybe is making some of the farm workers sick. So, yes, it would be great to have a captain, kind of steering the whole ship, but also, the sailors that are, down there.
We need the whole crew.
Yeah, we need the whole crew, so the people pumping out bilge water, they're important too for the ship not sinking, So there's really, what's really frankly exciting about public health is that there is a role for every sector of society and every level of government, and also for regular citizens as well. So this is not something, and I mean public health, not just a pandemic. Public health is something where everybody really needs to be a part of it. And so I don't want to imply that there's going to be one person or one group or one international body that is the answer. It's really about embracing public health as a public good, as something that's critical to our economy, something that's critical to peace and human development. So it's really, I think, more about changing values and aspirations than it is about changing government structures. Yeah, anything that involves culture change, takes a long time. But it's really possible.
Yeah.
It's definitely possible. And this pandemic, I think, has, it's teaching us many lessons as we go along. And I think people are, I think people are maybe appreciating public health a little bit more than they did before. And it's really true that culture change can happen. I mean, if you look at something like cigarette smoking, that used to be looked at as, well, that's just people's right to do. People are allowed to smoke, they're allowed to do that. It's their right to do that. Now, if you, I don't know, go into a restaurant and someone tried to smoke in there, people will be like, what is that person doing? And there's this, because we now know that one person smoking can actually harm another person, And so there's this sense of, well, we don't do that. Now we know, smoke if you want in your own home, you can't do it in public because that harms other people. And the whole culture around smoking has changed dramatically just in my lifetime. My mother's doctor actually advised her to smoke while she was pregnant with me to calm her nerves, because nerves were bad for the baby, So we've come a long way with some public health issues. And so it's all, it's definitely possible. Maybe I can just share a final thought about public health and pandemic, which is from an international standpoint, we do have the international health regulations, which is this sort of, it's a binding agreement, pretty much every country signed on, where we agree to share information about outbreaks, to try to prevent them from crossing borders, to contain them, to share intelligence about them. And, it exists on paper. It's like you read the international health regulations and you're like, yeah, those are amazing, except half the countries in the world do not have the resources to abide by them. They don't have the disease surveillance. And so I just want to, I guess, go back to the idea that countries need to have these basic resources. And until every country has a public health infrastructure, we're not going to be able to contain a pandemic. We're not going to be able to contain the next one. So just a final thought. It all comes down to, on the ground, are people able to see what's going on, measure it, analyze it, draw conclusions, and share those out? They can't do that. The next one's going to, the genie's going to escape from the bottle again.
So I'm curious, as you think about the current global landscape, which we've talked about, and the need for global health collaboration, what would be some key positions that Middlebury students could consider pursuing, and what skills are being sought after in this pandemic environment?
I think that, and I always say this to students, and I think you can see it in the pandemic, being able to work with data, understand data, interpret it, and communicate what it's saying out in a way that people understand is a critical skill. And it's interesting, this pandemic is, the extent to which scientific information is either not being communicated or being misunderstood is mind-blowing to me. And it really suggests that there's not enough, literacy with data. And a really critical function in public health is translating evidence into policy. Public health is evidence-based, but ultimately, what the science tells you is what each person needs to do individually. And people who can look at scientific information, understand the ramifications, and communicate that out are always going to be essential in public health, whether there's a pandemic or not. It's really about translating science into things people can understand, and also meeting people where they are. That's a lot of public health. So also some cultural understanding, some empathy, some compassion, some appreciation for different viewpoints and different cultural approaches to the idea of health or the idea of risk or responsibility are also necessary. If you're telling people what they have to do, are those people empowered to do what you're telling them to do or not? So I think a liberal arts education really prepares people well for these tasks, because at Middlebury College, students do a lot of research, they do a lot of writing. And it's communicating, what do we know, what do we not know? What do we think is true? What questions have arisen from what we know so far? And then communicating that out. And students can master those skills in any number of majors, or any number of sort of interests. So, and again, public health is so interdisciplinary and multidisciplinary that we need people, from all these different backgrounds who are able to carry out those skills. And I also think that students really encourage students to, get off campus, work in the local community, volunteer, because public health is interesting in that part of it depends on microbial science, but a lot of it depends on people's attitudes and values and understanding their challenges. So the more students can just get out there and see what is life like for people, they'll be better positioned to be influential in the field and to be effective, at implementing programs that are going to actually improve people's health.
Certainly. So you've absolutely covered this tangentially, but what are some other skills besides communication, besides data analysis, that are important for somebody who would like to pursue a career in global health?
I would actually talk more about values than skills, to be honest with you, because you can always learn new skills. You don't have to get every skill that you need professionally while you're in college. You hopefully will be learning out through your entire life. And what public health really requires is a commitment to public service. And the sense that you are on a team. And sometimes I talk to students and they kind of, they're saying like, well, I want to, lead something. I want to kind of be in charge. I want to be, calling the shots. And, public health is an all hands on deck kind of situation. And I really think that people need to embrace the idea of public service. There's certainly people working in public health that are, I don't know, making lots of money or in charge of something, or, whatever, however people identify being at the top. But the bulk of public health work is connected to, working on the social and structural determinants of health, serving the people who are most vulnerable, the most marginalized. And if a person doesn't want to be a part of that, then they're not going to last that long in public health. So it's really a willingness to be a part of that, to be a team member, and to be flexible. I mean, certainly working in infectious disease emergency preparedness, I mean, you had to come to work, like I knew I came to work every day knowing at any point something could happen. And you need to change your plans. You might need to learn something completely new. I remember, for instance, on September 11th, 2001, I had just gotten to work and someone said, this plane just hit the World Trade Center. And then the rest of the day, certainly ended up being a different day than I thought it was going to be when I showed up at work. And then anthrax hit. And then for months and months and months, people who normally did a different job had to change and work on something different. And that's how public health is. There's always some new threat that we're learning about. And you have to learn new skills all the time. And you have to say, okay, right now, maybe I'm not going to be taking this project I created to fruition, but I have to help out with this emergency, or there's, some group of people that have emerged as needing something. And you have to have a commitment to public service. You have to be flexible, and you have to understand that you are part of the solution and not the solution. And a lot of times students feel like they have to have all the answers, but I feel like it's like being on a sports team, you know, like you don't like pitch the ball and then run up to the plate and hit it before it gets there and then run to first and then, you know, catch. It's like you are part of a team. And I feel like these are, I guess to link it back to skills, you know, join an organization, like, you know, again, volunteer, get a part-time job, like learn what it means to work with people, you know, people from different backgrounds, people who have a different skill set, and just become a part of something and be a team member, because that's really what public health is about. The extent to which people can go out of their comfort zone, I feel like that's important in public health, you know, and for people to really challenge themselves. And also, I guess one thing that's difficult, I think, about preparing for a public health career, or maybe any career while you're a college student, is that your life is like totally compartmentalized in college. Like it's chunked into times, like there's fall semester, there's winter term, and there's spring semester, and there's summer. And there's this idea that you have to like start something, see it through, and wrap it up with a big red bow, you know, in one semester or in one summer. And professionally, things don't work that way. Like you might work on a project that might take years, or you might start the project and then get moved into a different position and then hand off that project to somebody else, you know? And so I think a great way to gain those skills while you're in college is to take on a leadership role in a student org, you know, where you have to meet with the outgoing graduating senior president and say, what do I need to know? You know, and then carry it through. And then when it's time for you to leave, hand it off to the next person. So there aren't a lot of opportunities really while you're in college to do, you know, sustainable work for like 4 years that you picked up from someone else and are going to hand off. But that's really professionally what you have to do in most industries, and certainly in public health. So I would say that would be, you know, not just being part of an organization, but take on a leadership role and learn what it's like to inherit a process that maybe you would have done differently, you know, and look at it and say, what's valuable about this and what can be changed or what should be changed. And then be prepared to hand it over to someone who might do it differently than what you want. But that's the way that you create sustainability in a project, you know, and that's ultimately the way things get done. Nothing after college, very few things are like in those little discrete chunks where you can just check off a big box and be like, did it, you know? So I think that's the last piece of advice I would give is to take on a leadership role.
Awesome. That definitely makes sense. I had also wanted to ask about the Fauci effect affecting graduate school applications, med school applications, that they're up 18% during the pandemic. So I'm curious if you have anything to say about that. And you've already mentioned ways to stand out or be appealing to potential employers or graduate schools, but if anything else crosses your mind.
I guess, well, what's intriguing to me about this Fauci effect is that, you know, Anthony Fauci does not really practice medicine. You know, I mean, he does other things, and I just, you know, and I talk to a lot of students one-on-one about this, but, you know, sometimes students come to me and they say, well, you know, I want to go to medical school because I want to make healthcare accessible to everybody. And I always say to them, well, that's not really what doctors do. You know, doctors save individual lives or help individual people one person at a time live a better life. And some doctors go into public health, or some doctors will go into health policy, but they are putting in 4 years of medical school, 3 or 4 years of residency, perhaps a fellowship, and then probably 10 years of clinical practice before they go and do those things. And so the Fauci effect might be increasing medical school applications, but, you know, people aren't going to be learning how to be Dr. Fauci in medical school, which I just hope is clear. Like, I hope that the Fauci effect is from people saying, I'm moved by, you know, people suffering from this disease and learning how to do better therapeutics for new disease. Like that's, I mean, hopefully that's why people are wanting to go to medical school, because, you know, Dr. Fauci has a very different role than what people will be doing for the next 7 years of medical school. But in terms of standing out, I think, you know, Middlebury students are really well prepared, and we have very good health professions advising here. And again, I think the difference is really getting your hands dirty and doing public service, volunteer, you know, gather information and understand like what it really means, you know, to practice medicine. And practicing medicine is actually quite difficult in our health policy environment. And patients a lot of times can't do what the doctor wants them to do. And so I just hope that all the increase in medical school applications is people who understand sort of what the clinical environment is like. But I feel like you guys stand out really well as you are, but you know, really understanding that most of public health is not about medicine. You know, it's great when doctors are public health minded, but a lot of public health comes down to things like poverty, you know, a lack of housing, a lack of clean water, violence in your neighborhood, violence in your home, you know, being exposed to toxic pollutants, you know, in the air you breathe, in the water that you drink. Like that's a lot of public health. And so, and we need people doing all of those other things as well. So, you know, understanding the difference between medicine and public health is really important for people going into either medicine or public health. Because at least in our country, they are very disconnected, and we work together, but the core focus of the work is actually quite different. And I would also say, you know, and consider like run for office. I mean, get involved, you know, that's a type of public service. And students have a lot of social justice concerns over poverty, concerns over inequality, you know, and government, like they are regular people, you know, like the Director General of the WHO, like Tedros, at one point he was just a regular guy. At one point he was a college student, you know, and it's not like the people in those positions are somehow different beings than the rest of us. You know, it just takes commitment and perseverance and saying, I'm going to get involved and I'm going to get my hands dirty and I'm going to make the change that I want to see if that's what's important, you know? So I don't know, sometimes college students act as if like, this is not their real life, you know, and college feels like this bubble and it's not really, this is real, this is it. Like, this is not a dress rehearsal. This is your life, you know? And you can start to get involved at any time, and you're part of a team. It's not all up to you. So just get out there, you know, and then those experiences will give you the narrative that you need to sell yourself in the future, because you'll have the knowledge and the passion and some skills, and it'll fall into place, I swear.
Of course. Well, thank you once again for your engagement and your insights. Are there any other final points you'd like to discuss?
Just obviously ask everyone to stay safe and hang in there. This pandemic has been a slog, and many of us have, you know, seen friends or family suffer or have lost people. And it's a very difficult time. And I just encourage, you know, everyone to hang in there, you know, and know this will end, not as soon as we'd like, but look for silver linings anywhere you can find them. And just say, you know, this is a marathon and we just, you know, we have to pace ourselves, but it'll be okay. So just, you know, everyone's been amazing, hanging in there and staying positive, and we just need to keep that up. So just encourage everyone to, you know, reach out to each other and and look for those silver linings. That's how we're going to make it through.
Thank you, Pam.
It's so good to talk to you, Sophie. It's always fun to talk to you.
Likewise.
Yeah.
Well, thank you once again. This concludes our episode within the series Exploring Careers in Global Security. Thank you all so much for watching. And before you go, I would just like to encourage you to check out the rest of the Exploring Careers in Global Security series for career perspectives from a number of professionals in a broad variety of organizations like innovation, international development, Capitol Hill, and public health. They can all be accessed through the events and program tab on the CCI website. Thank you again for watching.